Thanks, Derek. Today I'll be talking about the 12-month results from this study. I'd like to acknowledge all of the collaborators that have worked on this project. I have a consulting agreement with Optobionics Corporation for this study. The objectives of this talk are to review the visual response to the ASR device, to go over some confounding factors that we've encountered, and to review the next phase of the ASR project. 20 patients received the ASR device in the subretinal space supratemporal to the macula, as shown in this photograph. I'm going to move through the demographics quickly so we can spend more time on the data. Defining treatment response in RP patients can be tricky, but is obviously important. RP patients have a very slow rate of vision loss of approximately 1 letter per year. So common interpretations of clinically significant treatment response that we use may be quite inadequate for current clinical trials studying this patient population. We have no standard definition for clinically significant treatment response for RP patients. So for this trial, we defined a positive treatment responder as one in which a measurement of statistically significant improvement in the ETDRS letter score was measured from baseline to 12 months. Evidence of a statistically significant improvement was based on students' t-tests with a mean improvement of at least 2 standard errors and a mean improvement of at least 4 letters of vision. Standard error for change was estimated from the pooled within visit variance from multiple vision tests made on separate days at baseline and 12 months. This chart shows responder rates looking at thresholds ranging from 4 letters through 10 letters, and you can see that over time, the percentage of patients hitting these thresholds decreases, but if you look at the 10 letters, we see that 20% of implant patients hit that threshold, and 5% of fellow eyes hit that threshold. We had 3 patients that had statistically significant drops in vision of the implant eyes. 1 had the bleb that was created for insertion of the chip extend through the macula. The second patient had a cataract, and this fellow eye had a cataract as well. Subjective reporting of visual improvement from any of the patients was not fully supported by the objective data. So we did a comparison of objective data between responders and non-responders to further investigate this. We found that pupil dilation during vision testing and cataract progression both seem to have a negative impact on vision measurements, and this is thought to be due to increased glare and reduced contrast sensitivity. If we take a look at this chart of 10-letter responders, we did subgroup analysis, and if you look at the group that had 2 confounding factors, you see that both implant eyes and fellow eyes had 0%. They dropped to 0% of patients hitting that 10-letter threshold. If we look at the group that had no confounding factors, or just 1 confounding factor, we see that 40% of implant eyes hit the 10-letter threshold and 10% of the fellow eyes. We also tried to improve the reliability of the data by looking at vision measurement time points, not just at 12 months, but we pooled 9, 12, and 15 months and looked at the 10-letter responder rates. What we found was that the 10% of patients in the fellow eyes dropped to 0, while 40% were maintained in the implant eye. The mode of action is believed to be a neurotrophic factor-mediated action. Vision improvements are thought to be related to improvement in contrast sensitivity, as well as potential improvement in the functioning of existing photoreceptors. We had 3 cases of migration of the chip. We had 2 patients that had a fracture of the chip. Neither of these impacted the vision. We had twice as many patients that had progressive cataract formation that required surgery in the implant eyes. We had 1 case of macular retinoschisis with a macular hole, which was repaired with vitrectomy, and there was no significant change from baseline to the 12-month time point. So in conclusion, the ASR device appears to produce improvement in visual acuity in some patients 12 months after implantation. Vision testing in the dilated state and cataract progression were both identified as confounding factors that certainly need to be taken into account in the design of future studies. In collaboration with Hugo Quiros of Mexico, we've recently implanted the ASR device in an additional 12 patients all lacking either of these confounding factors to confirm these findings. Thank you.